All right, well, hi, I'm Brian Hagan, the creator of Purposeful Foam Rolling, our online foam rolling and self-care course, where we teach you how to use a foam roller self-care tools to work out your muscles' tightness safely, effectively, and efficiently. All right, we also help teach you how to go deeper and deeper into the muscle to get the deeper layer of tightness, stiffness, and soreness out of those muscles so that you can get back to doing the things that you love to do without the pain, the discomfort, and stiffness. All right, so let's go ahead. If you'd like to learn more about the course, check out the link below in the comments. It'll take you to our course outline, shows you the whole course, and there are some video clips. You can go ahead and just sort of check out what we do there. All right, so let's go ahead and talk about the muscle we're going to be talking about today, which is pectoralis minor, right? This is the one that can cause pain in the chest, pain in the arm, down the inside of the arm and into the hand, right? It can mimic cardiovascular issues or heart attack symptoms. So have your heart checked out first. If you're having these symptoms, go see your doctor. Make sure you have a good, healthy heart. And then if you still have these issues, it could possibly be this muscle. This muscle can mimic that, but get the heart checked out first. That's really important. All right, so pectoralis minor, where is it? So it's in the front of your body. It's actually underneath a more common muscle, pectoralis major. Most people know what that is, the chest muscle. It's underneath that. It actually attaches to your shoulder blade. The shoulder blade in the back here has a part that comes out toward the front, and this muscle attaches right to that. And then it drops down, and it's attaching to your ribs, the third, the fourth, and the fifth rib, right up in here. Okay? So again, it's attached to the shoulder blade, comes down and attaches into the ribs. Now, what does this muscle do? Well, this muscle, since it's attaching to the shoulder blade, it's going to pull that shoulder blade down, it's going to pull that shoulder blade inward, and it's going to pull that shoulder blade forward. Okay, so that's pretty much what it does, is it works with that shoulder blade. It gives us more mobility in the shoulder blade. Now, what happens when this muscle gets tight? Okay, well, let's move Mr. Manny around here, and we're going to explain that real quick. He doesn't fall over. Okay, so imagine that pectoralis minor muscle is tight, right? And it's pulling on the shoulder blade. So if it's pulling it downward, forward, and inward, it's going to take this shoulder blade and wing it outward. It's going to pull the inside part of your shoulder blade out and the bottom part of your shoulder blade up. All right. So if we're doing that in the course of our movement of our life, that's great. But if this is chronically tight and it creates that problem, we get this thing called winged out shoulder blade. Now, it's not everybody who has a tight pectoralis minor has a winged out shoulder, but it can create that problem, right? But it's at least forcing that shoulder blade upward. It may not wing it out for other reasons, but again, the force is still there. So that compromises the shoulder, and it really, the whole shoulder complex, I guess, it puts it out of position, and that creates a lot of long-term wear and tear on the shoulder joint. All right, so let's move Mr. Manny back around. And he's also, or this muscle is also attaching to the rib cage. So again, we're getting force, a pull on the rib cage. Over time, that's not good either. All right. So again, a tight pectoralis minor is not something we really want to have. All right. The other thing it can create is, like every other muscle, as it gets chronically tight over time, it can develop these things called hyper-irritated points. We call them trigger points. All muscles can get them, and they can create a pain pattern that's usually fairly common to that particular muscle. And pectoralis minor is no different. It can develop typically 2 trigger points. You can see them marked in the black here. And its pain pattern, again, can mimic that heart attack symptom. So again, have that checked out first. Here, when it's the muscle, when it's the trigger point, the most common place that pain shows up is right here in the upper part of the arm, the front deltoid muscle, right here. We can get pain right there, but you can get pain in the chest. And let's bring Mr. Manny around here again. I'll bring this arm up, and you'll notice that pain is going down the inside of his upper arm, the inside of the elbow, the inside of the forearm, all the way down to the inside of the palm of the hand, but just the pinky side of the palm and the last 3 fingers. All right, that's where that pain, we can get tingling, numbing, any of that kind of feeling. That's where it's going to show up. Okay, it goes all the way down that line. So other things that this muscle can create problems with or pain with is when you're reaching your arm, reaching forward, or if your arm is up and trying to reach back, you'll get this sort of restriction or pain, or it may even create the pain down the arm or in the shoulder. So again, that movement of the arm in the upright position, reaching forward and or up here and then reaching back, trying to grab something, you can feel that pain. All right. What causes this muscle to be tight? Well, modern life, unfortunately. I mean, a lot of muscles get tight because of our modern life. So sitting a lot, office workers, truck drivers, taxi drivers, people who drive long distances in their car, have long commutes, this can get this tight because it tends to help us into this rounded shoulder. This muscle tends to kind of help that, right? And the pectoralis major is involved in that also because it's so big. So as it gets tight, pectoralis minor gets tight. People who work out a lot with bench pressing, that can aggravate this because you need to, we always tell people it's 2 to 1. You do 2 exercises for the back to 1 in the front, right? Because we don't want these, I mean, it's good to have strong pectoralis minor muscles, but you don't want them massive and nothing in the back because you're just gonna create this problem, this rounded shoulder problem, okay? So just modern life, sitting, stress, all of that. So what do we do to take care of this? Well, I'm a big fan of getting a moist heat pack. Now we have a video on here on our channel that shows you how to make a hot, moist heat pack. So we show you how to do that with a dry towel, a faucet warm towel, and then a hot towel, right? And the reason why we want to use a moist towel is because moist heat is much better for muscles than dry heat, right? So taking a electric pad or electric blanket and putting it on here might feel good, but that dry heat dries the muscle out. The moist heat moisturizes the muscle. It's much better. If you go to physical therapy, they don't tend to put electrical blankets on you. They pull something out of hot boiling water and they put towels and they put that on there, and that heat just gets radiated into the body. It's amazing. So that's what you need to do. But make sure if you're using hot water, you don't want to burn the skin. So follow the directions. Okay. So once it's nice and warm, you can get a foam roller in here. Now, I'm going to show you how to do this. Right? But you need to understand that you've got to have flexibility in the whole shoulder complex, right? This is why we teach in our course the full body foam rolling, because we want you to work all the major muscle groups of the body so you have flexibility and mobility in the entire body, right? Because it's not uncommon for somebody to go, oh, I got a problem here, I'm going to do this, and they end up pulling a shoulder because they're not used to having their shoulder up here and they're trying to get in here and do this stuff and they pull something, okay? So I'm going to show you how to do this, but you really need flexibility and mobility in the whole entire body so that you can do these exercises without risk of injury. Okay, that's why we teach the full body. So you can do this against the wall, and you can do this against on the floor. You're going to take this foam roller, take the arm up, and place that foam roller right in here, and just roll back and forth right up in here, again, against the wall or against the floor. You can also use a tennis ball. Now it's a bit more aggressive. Right, so you need to be gentle. It's not about destroying a muscle the very first time you get on it, right? You don't go out and get a big gigantic rock and sit in here and try to beat this thing out of here because you're not going to have a good time, probably about 2 weeks, I would guess, if you do that. So it's about doing it consistently, gently over time to break it out of there, to remove it, but not to damage it, right? You also have arteries and nerves that come through here that go up the arm. They go right straight underneath this muscle and they come up the arm. You don't need to be beating that thing up in there because you need to be gentle here, okay? So again, use that tennis ball in there or the foam roller. Again, check with your doctor first before you do any exercise routine. Make sure you read our disclaimer, all right? Check it out with your medical facility first. If this doesn't seem to get the whole tingling, numbing sensation, you may have an issue with going up here. Again, that's something you want to check with your doctor, physical therapist, something like that, to make sure that you don't have any other additional areas going up here. All right. So that is self-care for pectoralis minor. We'll get Mr. Manny's arm down here. And stretching is the final phase. I love going into a corner or an open door and then just putting my hands on either side of the corner or on either side of the door, open door. And then you can go high, stretch, do that 2 or 3 times. You just stretch into the doorway, hold it, breathe, make sure you breathe, count to 8, relax, and then do it 2 or 3 more times. Drop the arms down to neutral or from here to here, and then lower. You can do all 3 of those 2 or 3 times, count to 8. Okay, but make sure you breathe when you're stretching. You got to breathe gently and exhale slowly because that's what's helping you relax And when you relax with your breathing, your body relaxes. Okay? All right. So that's Pectoralis Minor. Now, check out our course, because I'm a firm believer that you can't just focus on one muscle and expect wonderful things to happen. It's a full body. You want full mobility and flexibility in your body so that you can get out and do the things that you love to do without this tightness, this stiffness, and this pain, this muscle pain that you have. Full body. Okay? All right, this is Brian Hagan from Purposeful Foam Rolling. Have a great day. Take care.